I'm Dr. Kalpana, obstetrician gynecologist, fetal medicine specialist and infertility specialist at Kasturi Hospital and Morpheus Kasturi IVF Center, Hyderabad. The most common question asked by all the couples who usually come for infertility directly, maybe 1 year of infertility, maybe 10 years of infertility, is what is the problem? Where is the problem? It is very hard to tell initially without checking anything, but step by step when we do the treatment, when we check the individuals, we check a few basic things initially and then go for the next level, which includes in female when we take it, this is uterus, these are the tubes and these are the ovaries. Initial assessment would be after basic blood investigations, we check how is the uterus on a scan, on a 2D routine ultrasound. We check how is the uterus and how are the ovaries. These tubes cannot be seen on a routine scan. So when we see on the scan, when the lining of the uterus is fine, when the size is fine, then we check the ovaries. We check for the size of the ovaries and number of follicles in the ovaries. There is something called antral follicular count, which is very important in females who are going through infertility problems. Most commonly of late we are seeing a low AFC, poor ovarian reserves, where in common language we say there is less number of eggs, less number of follicles, where we have to go aggressively and go ahead with the next level of treatments and maybe land up in IVF in early stages of infertility too. So that is a stage where we say in this ovary, the number of antral follicles, which usually we count on day 2 to day 5 of the cycle, that is initial part of the menstrual cycle. We do a scan and see how many follicles, antral follicles are seen in both the ovaries. Usually on an average, it should be at least 8 to 10. In PCOD cases, polycystic ovarian syndrome cases, they have too many follicles here, maybe 20, 30 also in each ovary. In advanced age people, maybe 37, 38, 39 years, these storage in these ovaries reduces. Once the storage reduces, we see those antral follicles diminishing very fast after 35 years in Asian women. If it is around 2 or 3 in each ovary, we say it is very less and you have to act aggressively. Maybe you have to go for an IVF, freeze those follicles. Even if you're not planning for pregnancy, freeze them, because as the age advances, the storage keeps going low. It is very important to recognize the ovarian storage when it is going low. Once the storage is less, maybe 0 or 1 or 2 follicles, you cannot get back. As age cannot be taken back, the storage usually cannot go back. So you have to, as prolonged infertility cases, in few cases we keep seeing where this storage is not taken into serious account. Many people think that, okay, this month it is there, okay, let us go ahead with the treatment, let us see 1 more month, 2 more months, 3 more months. This prolonged treatment of conservative treatments like natural trying pregnancy or IUIs, they might suddenly land up in the poor ovarian reserve, where even if they come for an IVF, the numbers may be very low, and once the numbers goes low, usually with age the quality also goes low.